There's a silent superbug spreading in hospitals and healthcare facilities worldwide. It's called VRE, or Vancomycin-Resistant Enterococcus, a bacterial infection that's resistant to one of the strongest antibiotics we have. But what exactly is VRE? How do people get it? And most importantly, how can you protect yourself and your loved ones? Stay tuned as we break it all down. VRE, or Vancomycin-Resistant Enterococcus, is a type of bacteria that has become resistant to vancomycin, an antibiotic used to treat serious infections. Enterococcus bacteria normally live in the intestines and female reproductive tract without causing harm, but when they enter the bloodstream, urinary tract, or surgical wounds, they can cause severe infections that are difficult to treat. VRE is mostly spread in hospitals, nursing homes, and long-term care facilities. It spreads through direct contact with contaminated surfaces, medical equipment, or through person-to-person contact. VRE spreads easily in healthcare settings and affects people who are already vulnerable, such as those with weakened immune systems, patients with indwelling devices like catheters or IV lines, have wounds, and those with prolonged hospital stays, are in long-term care facilities, or require frequent hospital visits, or have previously taken antibiotics, especially vancomycin or other strong antibiotics. Because VRE is resistant to multiple antibiotics, treating it can be challenging, and infections may take longer to heal. The best way to prevent VRE is through strict hygiene practices and infection control measures. Here's how. Wash your hands frequently with soap and water or an alcohol-based sanitizer. Healthcare workers should wear gloves and gowns when caring for patients with VRE. Thoroughly clean and disinfect all shared hospital equipment and high-touch surfaces, as VRE can persist on surfaces for several days to weeks. Use antibiotics only when prescribed to avoid unnecessary exposure. Practice proper wound care by keeping surgical sites and open wounds clean. Keep urinary catheters or IV lines clean and well-maintained to prevent infection. By following these precautions, you can significantly reduce your risk of contracting or spreading VRE. If your loved one has VRE, there's no need to feel afraid or overwhelmed. Most people with VRE don't need to be isolated at home, and with a few simple habits, you can safely care for them and protect everyone else in your household. Wash your hands often. Just a good hand wash before and after helping your loved one goes a long way in keeping everyone safe. Keep things clean. Wipe down shared surfaces like bathroom counters, light switches, and doorknobs with regular household cleaners. Do laundry as usual. Their clothes, towels, and bed sheets can go in the regular wash using hot water and detergent. No need to separate it unless the items are heavily soiled. Avoid sharing personal items. Things like razors, toothbrushes, and towels should be for one person only. That's a good rule in general. Support good hygiene. Encourage your loved one to wash their hands regularly, especially after using the bathroom and before eating. While hospitals use extra precautions for VRE to protect vulnerable patients, people with VRE do not need to be isolated when they go home. Remember, VRE doesn't spread through casual contact like hugging or being in the same room. With some basic hygiene, your home remains a safe and loving space for everyone. VRE is a serious but preventable infection. By understanding the risks, recognizing symptoms, and practicing proper hygiene, you can protect yourself and your loved ones. Stay informed, stay safe. Have you or someone you know ever dealt with VRE? Share your experience in the comments below. Like, subscribe, and turn on notifications for more expert insights on infection control and public health.